Hello class, my name is Tricia Miller, and this week I will be discussing the core value of advocacy. The RN to BSN program incorporates 7 core values into the program that are recommended by the National League of Nursing. The 7 core values include caring, diversity, ethics, excellence, holism, integrity, and patient-centeredness. There are also 2 other values that are important to the nursing practice. These 2 values are communication and advocacy. To me, advocacy in nursing means speaking up for what is best for the patient. The Merriam-Webster dictionary defines an advocate as someone who pleads the cause of another. Nurses use the value of advocacy in everyday practice, whether they realize it or not. My routine at the hospital includes looking up daily labs, assessing the patient, and notifying the doctor of anything that the patient needs or wants. This is advocacy. If a patient's condition is deteriorating and they need transferred to a higher level of care, the nurse calls the doctor to advocate for the transfer. Nurses do this because it is what is best for the patient. Advocacy can also means speaking up for the patient when they say they don't want any more treatment. I think advocacy means that nurses are the protectors of patients. This can be a difficult thing to do. Advocacy is a skill that becomes better over time. New nurses don't always have the confidence to advocate as strongly for their patients as experienced nurses do. There are other ways for nurses to be advocates for patients. Nurses can advocate for safe staffing ratios. Having an adequate number of nurses to work helps us provide better care to our patients. This helps both nurses and patients. Nurses can be advocates for changes in policy also. Advocating for laws that provide safe practice standards protects nurses and patients. One thing that I do as a charge nurse to advocate for patients and nurses on my unit is look at information about new admissions and determine if they are appropriate for our floor. There are many times that the patient should go to a higher level of care, and I have to fight to get the patient to the right level of care. It is important to advocate for all patients because they are in a vulnerable position when they come to get treatment in the hospital. Patients do not know how to navigate the healthcare system or even understand the language that we use. Sometimes they do not even understand what treatments are available or what is best for their condition. This is why it is so important for nurses to be there and be an advocate for patients. Nurses want the best outcomes for all patients. Thank you for your time. Goodbye.